Hello, I'm Dr. Prasanna Shah. I'm a consultant gastroenterologist attached to Breach Candy, Jaslok and Saifee Hospital. My special area of interest now is obesity and mainly endoscopic management of obesity. We know obesity is a major problem. It's a crisis we all are facing and it's increasing. 650 million obese people around the world. India is amongst the top 3 obese nations in the world. Hence, only 1% of patients or people actually get any help for obesity, and that is surgery. Only 1%. So therefore, there's a huge scope for management of obesity. Apart from surgical, we have medical, pharmacological, lifestyle, diet, nutrition, and now endoscopic. In endoscopic, there's a huge range of endoscopy which is coming about. The established modalities of treatment are the intragastric balloon, we have the endoscopic sleeve gastroplasty, and we have the other stents which are coming in called the duodenal jejunal liners. We have the all-sense stent, and we have DMR, we have jejunal bypass. So the whole host of ones which are coming in. Which I do very commonly now are the intragastric balloon. We've placed more than 350 gastric balloons all over India. Patients have lost around 15 to 20 kilos of weight loss. Importance is that you have to be followed up by your nutritionists, dietitians, and also counseling by a good psychologist. And hence you'll get good results. By just putting in a gastric balloon, you will not get the desired results. So it's important that your patients undergo nutrition counseling, dietetics, and also psychological analysis, and you can then put them on any form of therapy one would want. So intragastric balloon, it's an OPD procedure. It takes around an hour to do it. You need not be admitted in the hospital, and they need to be monitored every weekly. There's a certain blood tests which have to be done prior to the endoscopy, and you don't need any monitoring post the gastric balloon placement. All you need to do is be in touch with your patient to ask them how they're doing, nausea, vomiting, pain, and to ask them how much is their weight loss. The other new modality which has come in is called the endoscopic sleeve gastroplasty. It is called ESG. It's basically you're suturing the stomach and making it into a pouch. The vis-a-vis other procedure which the surgeons do is the sleeve gastrectomy, where they cut the stomach into half. We are not doing that. We are endoscopically suturing the stomach and making the stomach into a small pouch. And we can expect a weight loss and a sustained weight loss for the first year, second year, and the third year, more than 10 to 20% expected body weight loss year on year. And so this is the advantage of this procedure. There are other procedures which are coming in called duodenal mucosal resurfacing. Then you have the duodenal jejunal liners and many other procedures. So these are the two main procedures one can do in India very safely. They are both US FDA approved by the Indian government also. The cost is not very high vis-a-vis surgery costs and costs of ICU stay, hospital stay. So the costs are much less. The take-home message I can only say is obesity is rising. It is a critical issue for all of us of all age groups, including childhood obesity. We need to address this as fast as possible because we are number 1 in diabetes, blood pressure, and other related problems. Obesity is a risk factor for even pancreatic cancer and colonic cancer. So hence, tackling obesity is very important. We need to work together as a team with dietitians and nutritionists and psychologists and form a team. So tackling obesity is a team effort. We need to address this as soon as possible. And there is hope for most of our patients. apart from just surgery. So we are going to an era of minimal invasive procedures, incision-less procedures to give maximum benefit. Thank you.